Hello and welcome to this brief video on the medication review assignment, which is one of the components for your portfolio for family medicine. Like in all the assignments, make sure that you complete this on every page. Circle your rotation, put in the date, put in your ID number. No patient identifiers apart from age and gender. Put in the name of your tutor, either the GP tutor or the clinic assistant tutor, and also the word count. This medication review must come from a face-to-face clinical medication review with the patient during your 5 weeks of clinical postings from weeks 2 through to week 6. Now be aware that these patients, especially if they are elderly, may have other illnesses, so-called multimorbidity, and therefore may be receiving many drugs, commonly referred to as polypharmacy. Therefore, there is potential recipe for harm here through inappropriate prescribing, excessive dosage, interaction with other drugs, etc. A lot of elderly people are harmed by taking several drugs and end up in hospital as a result, and some die, which is preventable. A word of warning here: you must use generic names for medications. So if you're using a drug like atorvastatin, then you should use that name rather than a brand name. There may be several brands of the same drug. If you have a drug called atorvastatin, rosuvastatin, simvastatin, at least then we know that these are statins and that I'm less likely to prescribe an inappropriate drug. If you have a brand name, however, I may be familiar with this particular brand, but I may not be familiar with 5 other brands, one of which you may prescribe. So therefore, predominantly generic names. This is in the interest of patient safety. Patients get harmed when doctors use brand name drugs because they may select a name which sounds similar to the drug they wish to prescribe, but prescribe the wrong drug. If you fail to use generic names, this will lead to loss of marks. Please list the illnesses your patient has and don't just leave it blank. If, for example, they've got 4 illnesses, then write down none or no other illness in each of those lines. These medication reviews are for patients who are on at least 5 prescribed medications, so you include the generic name. You may also use the brand name, but primarily the generic name, the drug group for which they come, the dose, the frequency, and the indication for which this drug is being prescribed. You should then next include in section 2 monitoring. Some medications require monitoring, not just an assessment of adverse effects as part of a consultation with the patient, but also specific things. So, for example, ACE inhibitors will require urine electrolytes. Statins will require LFTs and plus or minus creatine kinase. L-thyroxine will require TSH. Drugs like methotrexate, gold penicillamine used for rheumatoid disease, for example, will require full blood count LFTs every 2 to 3 months. And so this should all be mentioned. Patients on insulin will require fasting blood sugar, HbA1c, etc. All of that should be listed where appropriate. Section 3 looks at any problems with medications. The real advantage of doing a face-to-face medication review rather than simply looking at a list of the drugs without the patient being present is that you can get the patient's account of how these drugs are affecting him or her. So you can find out if they are having adverse effects. You can't find that out except with the patient being present. And you should list the problems as identified by the patient and yourself, but particularly the problems identified by the patient in their own words. So don't write down dyspnea, put down I feel breathless. And don't write down, let's say, melena or black stools on patients taking iron. Put on exactly what the patient tells you. Also list these problems and what action you have taken or you have advised for them to be resolved, or what action the patient may have taken, for example. You then summarize and also look at follow-up arrangements for that patient. So you summarize the overall management with reference to this medication review. So what are you going to do differently? What are you going to change? Are you going to stop medication, change dosage, swap medication, and so on? And if there's a date for a defined follow-up, then you should include that here.